we have non-Hodgkin's lymphoma, and then we have Hodgkin's lymphoma. So this is going to be the Hodgkin's type, which we normally call Hodgkin's disease. Also note that these are all codes that are related to patients being in remission. And if we remember what the in remission from an ICD-10 perspective means, that means that all of the cancer has been removed from the patient's body, and or they have completed their chemotherapy and or radiation treatment. That's when they're considered in remission. So we have to keep that in mind when we're coding. And you can see that in these particular codes, the fourth character has changed to identify the different kinds of Hodgkin lymphoma that's in remission. If, in fact, you don't have one of the first 5 as the information for what you're coding, but you have a kind of Hodgkin lymphoma, you're going to use the other code. So other Hodgkin lymphoma. And if you don't have what kind of Hodgkin lymphoma it is, then you're going to use the unspecified. Now, there are insurance companies that are now have is it post? No, they're maybe not post-traumatic, but caused by something else. And then we have the obstetric diabetes. So this is only affecting type 1. So there are not codes that deal with any other type of diabetes other than type 1. So you're only going to find these changes in the E10 section. And you can see that it's pre-symptomatic. Is the patient pre-symptomatic? Are they pre-symptomatic and it's unspecified? Or are they pre-symptomatic stage 1 or stage 2? Now, and again, these are going to be patients that have from the probably normally lab testing, they are showing as being diabetic, and they are type 1. However, they're not having any symptoms. So just because a patient is a type 1 diabetic doesn't mean that they're always diagnosed as a child. Morbid obesity, what's the unusual weight loss, those kinds of things that are related to the BMI are what you need to be as a second code. And that's always, that's not just if in fact you have a patient that has a normal BMI, and so they really don't have a problem related to their weight, then you shouldn't be coding it. So I run into this, if you know me, I've been in orthopedics for years and years. And a lot of times the orthopedic surgeons, when they have a patient who is obese and it causes a problem, usually in surgery is where the makes it more complex. They want to go ahead and bill the BMI to show that the patient was obese. But they don't realize that then we have to pick an obesity code also. And so that's another education piece. The thing about it is when you look at, for example, here, this obesity class, you may not know what they're talking about by obesity class. Now, if you went ahead and Googled it, it would probably tell you. But at any rate, if you go to the doctor and say, or the provider and say, they are now wanting us to identify the class of obesity, they're going to know what that means. I separate it out so that it is between Is it not tractable or intractable? And then is there an I have a hard time saying this word, epicalectus status or not? So we have not intractable with or without the status. I'm not even going to try to say that word again. Uh, or we have the intractable with or without that status. So expanding from one code to 4 codes. And then we have some embolism codes. So an embolism being a blockage or uh, like a clot. And you can see that there are different kinds of embolisms that we're talking about in these circumstances. The I codes are cardiovascular, and we have cement or fat, and we're talking about um, the uh, embolisms of the pulmonary artery, and then we're talking about with or without acute core pulmonal. This particular code has now been replaced. And so if we go back, or if it's an other specified area, we're going to, and we know what the area is, we're going to use the T81328. And then the T81329 is going to be used if we don't know. So that code has been replaced by those codes. Let's see where we are. Here we go.